All right. So good afternoon again, everyone. My name is Det Orwego, and I am the Managing Director of Assessment Analytics. Thank you for joining us today as we tackle a very important topic, mental health in the workplace. Mental health has become even more relevant today as we navigate through the ongoing changes in our work environment, working from home, the pandemic, different aspects of our personal lives, and the stress and anxiety that may come with all of these. In the next hour, we are lucky to have with us Dr. Robert Buenaventura, who will give us an overview of exactly what mental health or mental well being is and the possible mental health issues that you may be encountering in the workplace. He will also share some tips on how to create a mental health policy in compliance with Republic Act 11036, as well as some pointers on working in the new normal. We will also have some time at the end to discuss any questions you may have. So feel free to use the chat function to type in your questions so we can address them at the end of the session. For those joining us in Facebook Live, welcome as well. You may type in your questions in the comment sections later on. At this point, I am very proud to formally introduce Dr. Robert Buenaventura. Dr. Buenaventura is a magna cum laude graduate in clinical psychology and a board-certified psychiatrist with subspecialty training in psychogeriatrics from Sydney, Australia. He has more than 30 years of clinical and academic experience in both the private and public sectors. And he has also occupied top-level managerial positions. He is an internationally published author of research articles in psychiatry, the most recent of which was just published last week for the Asian Journal of Psychiatry. It's on reducing mental health stigma. At the same time, Dr. Buenaventura also has more than 15 years of corporate experience as a consultant and as a director for various local and multinational companies in local, regional, as well as global capacities. He has worked in Manila, Hong Kong, Singapore, Sydney, Australia, as well as Princeton in the US. At present, he heads the Department of Neurosciences in the Manila Theological College's College of Medicine. He is also an associate professor in human lifespan and psychiatry in La Consolacion University, Philippines, College of Medicine, and is also a consultant psychiatrist and visiting lecturer at the UERM MMC College of Medicine. So without further ado, I invite all of you to please join me in welcoming Dr. Robert Buenaventura.
Mabuhay at magandang hapon po sa inyong lahat. Thank you very much, Ms. Letty, for the very kind introduction. And I'm very happy to be here with you today to talk about this very important topic, actually. This is something that started discussing sometime a year before, okay? But the situation became more prominent as we went into the lockdown and the pandemic last year. So for this session, we're going to talk about mental health issues in the workplace, but because of time constraints, this is just mainly an overview and just essentially general discussion about the main issues that are involved in this situation. These are my objectives, so these have been sent to you as well by Assessment Analytics, and we will go through them one by one. Admittedly, not as extensively as we want to, but at least hopefully we'll be able to share with you some important concepts or ideas about each of these topics. So let's start first with an overview about what mental well-being is. The World Health Organization and the United Nations in particular have listed general health and well-being as part of its sustainable developmental goals for this decade, and therefore this emphasizes how critical this issue is for everyone concerned. Okay. And as a result, when we're talking about mental well-being, we need to understand first, of course, in terms of what's the difference between wellness, because these are two terms that we often hear. So while these terms are often used interchangeably, they do not appear to be exactly the same. For example, like well-being mainly focuses on how we perceive overall ourselves in our life in a positive manner. Okay. While wellness is mainly the practice of healthy habits that contribute to our well-being. But for the purposes of this lecture, we will be using them interchangeably with, of course, some unique nuances in between them. Mental health can affect many different areas of our lives, such as, for example, our work, home, uh, or school, relationships with others, um, vegetative functions such as sleep, appetite, energy levels, cognitive functions such as our ability to think clearly or make decisions, and even our physical health. Then, of course, that would include as well our life satisfaction. So these are just some of the areas that are involved when we talk about our mental health, and there are more because as we talk about mental health, we do realize that it's a very complex topic. But let me emphasize that our mental health is just as important to our lives as our physical health. Because more often than not, we tend to focus more in terms of our physical health to oftentimes the neglect of our mental health. But we need to understand that both our mental health and our physical health are equally important. And allow me to remind you that mental health is simply not just the absence of mental illness. And not because you're not mentally ill, that already means that you're mentally healthy. It may not be, because when you talk about mental health, as we have seen earlier in the previous slide, it's a very complex process. And specifically, we talk about other domains, for example, that when we talk about mental health, it includes four major domains. So emotional, psychological, social, and cognitive well-being. There are four basic dimensions of mental health and wellness, and these are the main areas in which our mental health become manifest, and they include number one, our thoughts, which would include the way we think about something, which of course would have a big impact in terms of our mental health. Changes in our thoughts often go along with changes in our mental health. Our body reactions, such as heart rate, breathing, digestion, etc. Our state of emotions, it is a big part of emotions, of course, is in terms of how we feel. So emotions can be pleasant, unpleasant, or blended, such as when we have two emotions at the same time, what we basically refer to as ambivalence, for those of you who have a great background in psychology. And finally, behaviors. Okay. The way we act and respond to our environments, and such some so that some behaviors may be helpful and some may be harmful. Okay. Now, I'd like to emphasize that mental health is determined by the overall patterns of these four basic dimensions. So these four basic dimensions will intersect or interact in terms of creating a picture of our overall mental health. Now, we go on to the second segment, but before we do that, I think we have a poll question. So for this lecture, we have a couple of poll questions, and now let's have the first one. Okay, so what are some of the mental health issues you're currently experiencing in your company? Okay, so just, pick one. We have about 30, 45 seconds. I'm glad to see that people are responding very quickly. Okay, I'm very happy to see that. So thank you for that. And I think this poll question will give us a better idea about the current state of mental health among our companies. So I think we have about 5 seconds left. So for those of you who have not voted yet, so thank you. So I hope you can see the poll results. Okay, so what we see here is that anxiety is way out in number one. So 60% of you said that this is one issue that and then lower productivity followed by increased absenteeism due to stress and hypertension. So thank you very much. So these are just four of the choices that are available because there are a lot more. Okay, so thank you very much for that, and we'll proceed with the topic. Okay. So I hope you can see the slides again. In a study in the workplace, showed that 32% of government employees in 20 agencies in Metro Manila reported experiencing mental health problems at least once in their lifetime. This according to data from the National Epidemiology Center of the Department of Health. Although this was in 2006, but there we don't have any more current data. But at least this is it's a very good example of what we might also be seeing right now. So about one third, okay. And if you look at that, what are the three most common diagnoses? Okay, so specifically, I mean, so the employees manifested specific phobias, alcohol abuse, and depression. Okay, in that order. And this is not uncommon. Okay, because if you look at it from a worldwide perspective, this might also be something that we might similarly see in workplace setting. But this is among government employees in 20 agencies in Metro Manila. So what can we see among individuals in private sector setting? This is a study from Dr. Melgar from the Ateneo Bolatao Center for Psychological Services. And they found that in the workplace, okay, the uh, top mental health issues would be the following. So that include job burnout, clearly number one, followed by irritability, lack of motivation, chronic physical complaints, and anxiety. So this was done by a survey. Okay. And so in terms of the number of respondents that they have, this is also, I think, very good information that we have. So additional information coming from this is in terms of another question that they asked was what stresses employees most? Okay. Of course, we have to remember that this was pre-pandemic. This was done around 2019. In fact, for those of you involved in occupational medicine, this was presented during a convention during one convention in that specialty. Okay. So in terms of work-related stressors, they said traffic was number one in commuting, okay, and working beyond regular hours. Family-related included family conflicts, relationship with partner, and having no helper at home. And then third column would be general and health related, such as taking care of finances, concerns about the future, and mental health concerns. What I would like to emphasize as far as this slide is concerned is that our concerns are multifactorial. So it doesn't just come from one segment of our lives. For example, something that may become manifest at work could be due to issues that are arising from concerns that are coming from the home, okay? Or something that can be manifest at home can actually be due to something that's happening at work. So what I'm saying is that all these things are interdependent of each other. And therefore, that's why when we talk about mental health in the workplace, we do not just focus about issues that are arising from the workplace, but also we need to consider other aspects of the individual's lives as well, okay? Because they can also have a significant impact in terms of how the individual functions at work. So from the same study, they also asked the participants about something that they experience often or always. So 8.5% felt very sad, hopeless, and empty in the past month, and 9.1% manifested the loss of interest in people or activities in the past month. And these are two significant symptoms. And in fact, from a clinical perspective, these are what we call the primary criteria for the diagnosis of major depression. So the presence of one or both of these two manifestations can signal that the individual may be suffering from a depressive disorder. And then, of course, when you talk about depression in particular, one of the most critical aspects, manifestations of the disease would be having suicidal thoughts or behavior. So 5.1% thought of taking their life in the past 12 months, 1.1% attempted to take their own life, and 2.4% physically harmed themselves without intending to take their own life in the last 12 months. Okay, so this is, I think, a very important piece of information, and should give employees and employers a good idea in terms of what may be happening in the workplace. Now we come to our second poll question before we proceed to the next segment on creating a mental health policy. So let's have the next poll question, please. Okay, so the question is, do you have a policy on mental health in your company? So is it yes? Are you currently writing or revising? Or is it no? Okay. You're a very responsive audience, and I do appreciate that. So thank you very much. Mukhang nangunguna ang no, but I'm glad to see that about one fourth to one third are currently writing or revising a mental health policy in the workplace. So I think everyone has finished voting. So I guess we can close the poll. Okay. So more than half, a little more than half, said that they have no mental health policy, and about a little over 25% have are currently writing one, and 17%. And I'm glad to see that 70% already have a policy on mental health in their company. Okay. And I guess that's the reason why a lot of you are here right now to have a better idea about the importance of this issue as far as our workplace is concerned. So let's proceed, as far as about creating a mental health policy. Okay. So let me just set up some background information. We know that because research has shown that there are more workers who are absent from work because of stress and anxiety than because of physical illness or injury. So the psychosocial impact of illness is more critical as far as absenteeism rather than actual physical illness. And productivity losses due to mental health problems have been quantified in several studies. For example, as you can see, based on the WHO World Health Report of 2004, that mental health problems do play a very significant role as far as its impact on productivity. And there are other costs of mental health. And some of them are often indirect. No, so it might not be a direct cost that can be measured, but oftentimes it can also be due to indirect costs, such as increased rates of short-term disability, safety incidents, okay, absenteeism and presenteeism. For those of you who are not familiar with the term presenteeism, it's basically working or reporting to work while sick, okay, because a lot of people feel pressured to go to work even though they're not feeling well. So that's what we would call presenteeism. And mental health problems can also lead to underperformance and, of course, unrealized outputs. Stress imposed on team members, particularly because if you're working within a team and then one team member is absent due to illness, whether mental health or physical, then of course it can impose additional burden on other members of the team because you have to pick up on the slack. Okay. And oftentimes this can also lead to overtime and overstaffing because you will need someone to cover sick day absences and hiring costs related to recruitment and retention. Okay. The good thing about this is that as early as 2019, the WHO already actually came out, okay, with a guidance package about the development of mental health policies and programs in the workplace. I'm not sure if you've seen that. Let me read the main blurb on the cover of the package. The development and implementation of a workplace mental health policy and program will benefit the health of employees, increase productivity of the company, and will contribute to the well-being of the community at large. Okay, so the package provides guidance for policymakers and planners on developing policies and comprehensive strategies for improving the mental health populations and using existing resources to achieve the greatest possible benefits, providing effective services to people in need and helping people with mental disorders to reintegrate into all aspects of community life, thus improving their overall quality of life. What is interesting is that looking after employees' mental health is actually a solid and wise investment. According to a study that was published in 2016, every single dollar that's invested in scaling up treatment for depression and anxiety leads to a return of $4 in better health and ability to work. So that means when a company invests on the mental health or mental well-being of its employees, that there's going to be a huge return of investment, because oftentimes people feel that the reason that they don't spend for this because they don't think that it's going to be worthwhile, that there's not going to be a return. But as we can see here, there's actually going to be a return. Okay. And that's why it's very important to emphasize this to employers and other policymakers as well. Okay, so Ma'am that mentioned earlier about Republic Act 11036, so which we know as the mental health law, and this was signed into law on June 20th, 2018, with the implementing rules and regulations coming out in January 2019. So this is a fully enforceable law. It's just that there are some areas that need to have a little bit more finer details. Okay. So how does this affect us as far as mental health in the workplace? Because there's a specific section in this Republic Act, and this is Section 25, that talks about mental health promotion and policies in the workplace. So what is stated here, employees shall develop appropriate policies and programs on mental health in the workplace designed to raise awareness on mental health issues, correct the stigma and discrimination associated with mental health conditions, identify and provide support for individuals at risk, and facilitate access of individuals with mental health conditions to treatment and psychosocial support. Now, this can be a very complex process, with the employee in the center and or other stakeholders around, including the employer, the Civil Service Commission, the Department of Labor and Employment, local government units, Department of Budget and Management, others, including professional organizations such as the one organization that I belong to, the Philippine Psychiatric Association, and also for example, the Psychological Association of the Philippines. So there's going to be a complex interplay of all these multiple stakeholders as far as developing mental health promotion and policies in the workplace. Um, and with that, I'd like to segue into the next topic, which is in terms of looking at the levels of mental health services. So this general view about what services can be provided. So there are three levels, and I'm looking at this primarily from, shall we say, a very traditional medical concept in terms of primary level, secondary, and tertiary, in terms of preventive, active treatment, and then recovery and rehabilitation. So an important task is at the very least, at the earliest possible time, to prevent as much as possible, to provide preventive measures as far as mental health is concerned. So primary prevention and mental health promotion. So this could include addressing modifiable risk factors and bolstering protective factors, building a workplace culture that enhances health and well-being, or where employees feel valued, supported, and stimulated to perform at their best in their work, and educating about mental health. Secondary level of mental health services would include early detection and support for workers showing signs of mental health problems, so providing access to services or even a prompt referral for treatment. Then finally, in third level, okay, monitoring and support for workers undergoing treatment to ensure recovery and rehabilitation, so that they will be able to go back to work and be as productive as possible. Okay. So yun yung three levels. So what are some of the suggested programs? Actually, marami. So these are just some that I got from a friend of mine who's involved in this setting. So I asked her, so what can some of the programs can be done? Sabi niya, example, you can have social or socialization activities for employees. No, it could be twice a month or minsan once a month. A company that I worked for previously, meron kaming the last Friday afternoon of the month was dedicated to socialization activities. Okay, and the company would spend for that. Okay, there could be regular emergency consults with mental health professionals, including mental health checkups in the APEs, yung mga annual physical exams. So pwedeng sabayan na rin ng mental health checkups. Okay, and creating a programs that will enhance total well-being, inclusion of mental and neurological care in your HMO services, involvement of the DOLE to audit implementation of MH programs and policies. And this was something that I think companies would appreciate, providing tax breaks for companies who have a very good mental health program in place. Okay. But a question that needs to be answered is in terms of the challenges that would be involved. For example, how realistic and feasible are these given the conditions in the country? For example, there are really not enough psychologists or psychiatrists. And even another question would be cost of resources. So, and also, for example, what about inputs from the Department of Labor and Employment, labor groups, employees, and of course, employers as well. So, kumbaga, inputs from all the various stakeholders. And then how specific can these requirements be, and who will give them in the absence of qualified resources? So those are also points of consideration. And that's why there's a need for more information, such as capacity or resources of companies, manpower resources, mental health, such as, for example, mental health professionals, and the process of policy development. So itong last one, process of policy development. So ito na nga yung pinupuntihan natin sa ngayon. So overall, kasi, why would this be very important? Let's look in terms of what Canada's mental health in the workplace policy is, because they said that they found that the benefits, that there are a lot of benefits of a psychologically healthy workplace. For example, there would be better engagement, morale, satisfaction, retention and recruitment, and productivity, with a reduction in absenteeism, grievances, health costs, medical disability, workplace injuries. And that's why employers should assess their workplace for hazards, whether physical or psychological, then develop a plan to address and mitigate those hazards. Now, this is the last segment of this afternoon's lecture, and that's in terms of working in the new normal. Okay. This is actually a very nice topic, and there's a lot of interesting aspects. But again, unfortunately, we won't be able to discuss this extensively. So the new normal, all of us need to really adapt to the changes that are being brought about by the new normal. And we can see in terms of how life has changed due to COVID-19. And hopefully some of the tips that I'm going to mention here will enable us to be able to cope. We know that the way we live has become so much different from about a year ago. Okay, and as you can see in terms of how we travel, how we play sports or watch sports, how we celebrate holidays and other occasions, have remarkably changed. And the way we socialize and connect looks very different also. And an important aspect here, of course, in terms of social distancing or physical distancing. A lot of us are now interacting with our loved ones via Zoom or other digital platforms. Patients go to doctors with a plastic barrier in front of them. So these are also areas that have been affected, and also in terms of how we worship, has changed. And as you can see, for example, like yung capacity of the number of people who can go into church has also diminished. In fact, physical distancing is strictly maintained. Like, for example, when we sing the Ama Namin or the Our Father, no more holding hands. And I don't know if you've heard, because tomorrow is Ash Wednesday, that there will be no stamping of the ash of the cross on our foreheads. Instead, for example, like in our parish, ash will instead be sprinkled on our heads like that. So I thought that's going to be interesting. Okay, so wala nang marka ng cross, and then so mag-iba na. So ang laking pagbabago, as far as our religious practices are concerned. And of course, yung pinupunta rin natin in terms of studying and work. Okay, so education, as we now know, it has changed. So school and universities have moved online. Okay, some are going to try now to blend face-to-face with online lectures. Okay, but in terms of how we work, it has also remarkably changed. So many of us have shifted to working from home to minimize traveling via public transport or gathering in groups in the office. Now, Zoom meetings, have become our new normal as far as working is concerned. But eventually, with restrictions easing, we may cautiously rotate back to work, which some companies are already doing. Sometime in third quarter of last year, I consulted with a couple of companies about how they will be transitioning some of their employees going back to work. Because of course, one of the issues that was frequently raised by the employees about their safety, and that was, of course, a very important point of concern. So companies had to make sure or ensure that there would be appropriate precautions and safety guidelines to be able to allow employees to transition to working back into the office. Okay, but still there are those who are still having difficult time working from home. There are still individuals who have got not fully gotten adjusted to that, particularly because, for example, like their mindset is still not working from. For example, yung mga salespeople, kasi mindset nila is working in the field, meeting their customers, so that the changes about staying at home and calling their customers online or via phone have still been very difficult for them to manage. So how do we adapt to the new normal? So this is just something that I came up with in terms of some of the things that we need to consider. And these are not necessarily sequential, so that means hindi to sunod-sunod, but they can happen simultaneously while moving forward, or one can be done ahead of the other. But I thought that, you can start first by reviewing what your needs and wants are. So ano ba yung gusto mo mangyari? Ano ba yung pangangailangan mo sa ngayon? Ano ba yung gusto mo? Because you need to understand that first, okay? Because that will essentially help you set up what you want to do later on. And because you also need to understand ano yung mga areas of challenge. For example, like, is traveling going to be a problem for you? Okay, being away from your family, for example, because a lot of us have become housebound, and I know a lot of individuals, for example, who have been made redundant. Okay, like one spouse is being made redundant, and only one spouse is working now, and therefore they have to share the income of one spouse instead of having two incomes before. So identify those kinds of areas of challenges, because because you need to be able to plan out more in terms of what you're going to do, knowing what you need to be dealing with. Okay. And that's why it's also important, because if you're going to make a change, in terms of your current situation, you need to understand, of course, your own your important and relevant competencies. You need to ask yourself, is what can I do? Okay, is what I do, what I know, are my skills something that's important to the company, and are they going to be willing to retain me because of those skills, or are my competencies not enough, and therefore you would need to consider, for example, updating your skill sets. So, for example, if you're here, then should you be up here? So that's something you would need to consider. That's why I know a lot of individuals, like even myself, I know during the pandemic, there were a lot of free online courses, and that was something that we needed to do. Like in my case, I also teach in the medical school, so I had to update my skill sets in terms of being able to teach online, because otherwise I would be left behind and I wouldn't know how to be able to assist my students in gaining knowledge. But that's why I had to learn how to use Google Meet and how to use other learning management systems, because that was something that was going to be important as far as how I would need to adapt to the new normal way of teaching in medical schools. And what I mentioned earlier, in terms of needs and wants, would also be related to this, yung revising our expectations, and tempering our outcomes. Tempering our expectations, basically, because the outcomes and results generally would be lower than what we would expect. So we know that from the end of 2020, so a lot of companies closed because they were not able to meet their quota, ganun. So that's where companies had to make a lot of changes, and therefore, as individuals, we need to be able to do the same, change our expectations and revise what our forecast will be. But hopefully, as the new year comes in, and with the promise of effective vaccines, that all these things can come into a better situation. But at the moment, we need to develop what I refer to as realistic optimism. Trying to be optimistic, but at the same time trying to be grounded. Looking forward, but at least tempering our outlook so that we don't become too disappointed at the end of the day. And then finally, okay, we reallocate our resources. So kung ito lang yung meron tayo sa ngayon, so that means we need to save, we need to spend less, we need to, and then we need to be able to explain that to other members of the family, particularly if we're the breadwinners, or the heads of the family, so that there could be again realignment of expectations based on the allocation of resources. So hopefully, all these steps in adapting to the new normal will be very helpful. There are more, okay, but this I felt was just some of the few that I would like to discuss at this point. So with that, I'd like to just mention that that mental health in the workplace is a very important issue, and therefore all of us who are participating in this webinar right now are well placed to be able to make sure that this is something that we can have in our place of work, because now we understand better how much more helpful it can be, how much more benefits it can provide to not just the individual employee, but including the company or the employers as well. Okay. Um, I mentioned earlier that I was going. I'm not sure if I mentioned that I was planning a special, like an activity for everyone, and also I hope you'll be able to participate in this. This is a short autogenic session, this is just a relaxation technique, and just let me set it up because it will require me to change monitor. So just give me a couple of seconds. So so this is an autogenic session. This is an example of a relaxation technique that I usually um, employ with my patients, and I hope this is something that. So if you're at home or whether in the office, just try to sit comfortably, and then just listen, uh, to this video, short video.
Lean back and make yourself comfortable. Hands on your thighs. And now, close your eyes. Listen only to my voice, to the music. Focus on what I say and follow what I tell you to do. Now think of a place that you love, a place that is serene, quiet, comfortable, a place that makes you feel relaxed. It could be on the beach, on a mountaintop, even your own bedroom. Now imagine yourself in this place. Imagine yourself in this wonderful, beautiful place. Relaxing, chilling. You feel so good, calm, relaxed. While you're imagining yourself in this place, let us focus on your breathing. Take slow, deep breaths. Breathe in through your mouth and breathe out through your nose. Breathe in deeply and breathe out. Breathe in, 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 breathe out. You may open your eyes now. You may stand up and raise your arms to stretch. Now put your arms down. The session is over. Thank you.
Well, that's it about that autogenic session. So I apologize with some of the distractions earlier, but I I think we have some questions. So I turn it over back to Ma'am Detty for the Q&A, or Ma'am Carol.
Yes. Hello. Thank you, Dr. Benaventura. We already have a couple of questions. They couldn't stop themselves from asking questions while you were still talking. Anyway, the first question was from Andrew Ace Mano. He said that in this gamut of human resource development and human resource management, so does the implementation of RA 9258 or Guidance and Counseling Act of 2004 still suffice with the demands of new normal work setup?
That's a good point, although I'm not too familiar with that. But the thing is, when the development of the mental health law, they look in terms of, they considered actually 73 other Republic Acts. No? And some of these are actually overlapping. And even from a clinical perspective, for example, like yung Drug Abuse Act is also overlapping with this. So that's possible, that's a good point. So that you would need to consider that in developing a mental health policy as far as your workplace is concerned. So thank you for bringing that to our attention.
Okay. Can employees through the union sue the company without mental health policies and intervention? I think, pwede ba yun? If there's no policy.
Unfortunately, I'm not a legal expert, so I'm not sure about suing. Pero remember, oftentimes, for example, like at the moment, maaaring hindi pa rin fault ng company yan, because we need to remember that overall kasi with the Republic Act 11036, the lead agency is the Department of Health, no? Pero for some sections, like for example itong Section 25, Mental Health Work Policies, syempre DOLE ang magiging pinuno dito. So importante din yung, for example, yung mga implementing rules and regulations. Like what I mentioned earlier, there are still finer details that need to be ironed out. Okay, but so I'm not sure if you can sue, but we need to consider also that maaaring hindi lang na-implement because kulang pa yung yung implementing rules and regulations.
Okay. What skills are essential to help adopt to the new normal? That's a question from Karen.
So yung nabanggit ko, yung second to the last slide ko yata. So yun yung mga skills or activities that you can do. Kasi for example, like with skills, yung understanding your current competencies, are these enough to be able to deal with the new normal, or do you need to update your skill sets? So you will be the one to be able to respond to that question in terms of what you need to do, because that would depend on what you want to do. Kaya nga sabi ko, diba, understand yung what your needs and wants are. At this point, would you like to stay within your company? Okay, stay within your company doing the same work, then that means you don't need to update or anything kasi kung yun din ang gagawin mo. But are you angling for a promotion? So that means, diba, usually that would mean developing, updating your skill set, or transferring to a different department, no? Or even transferring to a different company altogether, no? So tayo yung makakasagot nun, because tayo nakakaintindi, we're the ones who understand what we need and want, and therefore but the point is we do need to, more often than not, unless you want to remain at the same position doing the same things, then you probably don't need to update your skills.
Okay. Next question from Moses. How are the employee assistance programs, or EAP, promote compliance to the mental health law on private companies?
Okay. Ano palagay mo? Maybe you will be able to answer this as well. Kasi from our perspective, kasi we leave that to our HR colleagues primarily. No? But kasi yung sa amin, yung sa akin in particular, ang punto namin is in terms of helping developing the programs. Pero in terms of yung compliance, siguro ibang area na yun.
Yes. Yes. Compliance kasi is per company, but the law says that organizations or companies should have a policy on mental health, but how they implement it, how they roll it out, and how they make sure that employees comply to it is another thing. So on the part of the company, the uh, the role is to just create a policy so that when the need arises, everyone would know what to do. Diba? Kasi we all have policies on different aspects, HR policies, but I don't know if there are organizations without the mandate from DOLE. I don't know if organizations have really thought about creating a mental health policy. Kasi parang it's something that is also new. Kasi
Oh,
we,
yes. Oh.
di ba? Maraming may mga policies na, pero you have a policy on attendance, policy on uniform, etc. But this is actually a very recent development. I was actually surprised that it was already implemented. So even kami, we just started drafting our own policy.
An HR director of a multinational company that I spoke to middle of last year was actually along the same lines, and so because first and foremost their company is multinational now, so that means they report globally, and therefore there was a huge not pressure, but parang from the top they were being told na locally na since there's a mental health law, then you should make sure that your company complies because ayaw nila nga ma-penalize. Okay? So that exerted some degree of pressure in terms of ensuring that these were implemented. But at that point last year, there was still a lot of gray areas, a lot of information that was not still available.
Related to that question kasi is the question of Jeff on how the HR professionals can encourage top management or employers to have a good mental health policy and programs as employees.
So with this HR manager, she's a woman. She's been in the industry for more than 10 years. So she realized at the outset that this was something that was important. So she made very strong not just a proposal, but to do something parang naging cause niya, so she would always bring it up. And in her situation naman kasi from a local perspective, it wasn't too difficult kasi nga may mandate na from above. I think the real challenge would be, for example, for local companies. For example, may mga let's say pharmaceutical companies din tayo that are fully local, di ba? Yung mga those who come up with, let's say, branded generics. So one question that they often have is, how do we do this? Do we have the resources for this? And is there going to be a buy-in? But the great thing about this, particularly with companies that are involved in catering to mental health professionals, like specifically like psychiatrists and neurologists, may mindset sila about acceptance of the importance of mental health, and therefore that kind of mindset will vary from company to company.
Tapos, Doctor, you mentioned earlier that when you were with a company you were connected with, you had socialization activities. So there was a question here about what kind of socialization activities did you do?
Oh, that was actually very simple. So at yung socialization activity na yun was assigned to each department. So magro-rotate yun. So if, for example, finance department, sila yung nakaschedule. It's up to them what they want to do. Tapos, for example, pag nataon, let's say, na February, Valentine's Day, so they can decorate the office with balloons and hearts and roses, ganon. Tapos serve wine, ganon lang. Tapos people can just, pinaka the best nun, kasi this was in Sydney, Australia, was when it was the turn of a specific department. Tapos yung isang Pilipina yung in charge, nagpa-karaoke siya, and everyone loved it. Okay.
Okay. Socialization kasi in this time when most are working remotely, just like us in assessment analytics, we love socialization activities too. But we needed to find a way to still continue with our socialization activities, even if we were working from home. So there was one meeting when the one in charge of the meeting hosted a game, and we liked it. So sabi namin, every week, every time we have an assembly, so there's now an assembly team in charge every week in running a short activity. It can be a game. Like this morning, we just had a bring me. So the bring me, it's just a bring me something that is close to your heart. And then you just show it, or bring me something that made you smile. So it's a simple activity where we're still able to socialize, continue what we loved doing before, parang without letting this pandemic disrupt our the way we do our work. So
Yep.
we have learned to cope, although mga 1 year na rin naman, di ba? So we have learned to adapt also.
I totally agree, no. Kasi social integration is very critical. I mean, like in myself, no, sa Department of Psychiatry at UERM, nung sinabi ng department head namin na, oh, we're going to have Christmas party, online Christmas party on December 16. Sabi ko, paano gagawin yun? Pero when I attended, I was very close. I enjoyed myself. Like yung bring me, sinabi mo nga, no? Like there was one item, bring me a wooden spoon. So may mga nagdala ng mga display na malala. Di ba ang saya, no? Sa mga ganon. Tapos merong electronic na ruleta, no? So for the raffle draw. So diba, yung mga ganon. Tapos you're online but you're having a good time.
Yeah. There are two more questions, but okay. One is about how we can convince top management to consider mental health break or leave as part of employee benefit. Would you have any suggestions?
Yes, ang suggestion would be case studies, ano? Kasi maraming case studies. Let's for example, yung study nga that I cited, yung Ketchizong, that was published in the Lancet in 2016, yung investing $1 will have a return of $4. Kasi may mga may mga companies na siguro most of the case studies will come from abroad. But the thing is, they have a mental health break. I forgot which company because I dealt with this company. There is one company that has you can have like in a month you are allowed to take like one mental health day, parang ganon. Well, when mental wellness or mental well-being day. I'm happy to say, for example, like UERM Hospital, now where I'm connected with, we have a full-time wellness physician. No? May full-time wellness physician. But of course, ang laki ng hospital. So but the thing is, meron siyang programs, okay? And this of course is great. And siyempre magiging problema ng implementation. But at least the hospital has recognized that there's a need for this, and that's why we have a wellness physician who's there to be able to ensure this. So hindi lang mental wellness, but also physical wellness, no? She's there to advise about diet and other activities, no? But also, kasi we work together in a seminar, no? So sa akin naman napasa yung developing positive mental wellness.
Okay. Just one last question on actually two questions. One is about her question was any tips to strike the balance between Zoom fatigue or meeting fatigue and conducting socialization activities during the new normal?
One of the things that I liked when I was studying psychology, because for example, like before when you would attend conventions on psychological association in the Philippines, or the seminars that are primarily run by the psychologists, di ba merong stretch breaks, palagi yun at the end of a session or before you start, let's say, the afternoon session, may stretch breaks, mga ganon. So that's something that I would recognize. The problem here is particularly for individuals who are multitasking. Kasi for example, if you're zooming lang in just one company, then you can tell your boss, I've already been in Zoom for like 4 hours today. So baka pwedeng hindi mo na. Or but other people, like in my case, I teach in 3 different medical schools and then I still have my online clinic. Iba-iba yon. But I try to spread that out. No, for example, like in between consultations na I leave about 10 to 15 minutes so that I can have like a stretch break, no? Kasi even our eyes can develop fatigue, so that we just look far away and then take a sip of water or even coffee.
Okay. Last question na to talaga. What is the stand of the Association of Psychiatrists and Psychologists on including psychological services in PhilHealth and HMO?
I don't know about sa psychologists. Pero sa psychiatrists, gusto namin yun. In fact, we've been, ang tawag doon, we've been sort of lobbying.
Yes.
We've been sort of lobbying for that. But oftentimes the reply kasi sa amin is that the problem kasi with a lot of psychological, psychiatric conditions, they tend to be chronic. No? So PhilHealth doesn't want to spend so much. So if ever they would spend, it becomes very limited. Or only, for example, like acute care lang. So a colleague of mine who's from a government hospital is the one representing us. Pero sabi nga niya, the main the main challenge that we're facing as far as that is concerned is there's a different level of understanding as far as
Yeah.
psychological or psychiatric illnesses is as compared to mga traditional medical conditions.
Yeah. Actually, this pandemic has really resulted to a lot of anxiety and stress to all of us. Diba? We worry a lot about our physical health. Parati tayong may alcohol. Parati tayong naghuhugas ng kamay because we're so afraid that we will catch the virus. But I don't remember anyone speaking about the effect of this pandemic on our mental health. It's always about our physical health, diba? But at the back of we don't really know that this has also affected us psychologically or mentally. So I don't know if it has something to do about the stigma associated with mental health. So I read somewhere that in a research done, stigma is one of the leading factors contributing to poor mental health outcomes, so that those needing assistance in the area of mental health delayed yung treatment nila, or they don't get the help that they need right away because of the stigma associated with it. I know that you've just recently published an article about this stigma, and I know that there's not enough time to talk about this in this webinar. But whatever you have shared with us was really very insightful. It was a short, but I think it was a very informative presentation. We will not be able to answer all of your questions, but feel free to send them to us through email. We will try to put them all together, and then Dr. Buenaventura might not be able to answer all of it, especially kung 100 questions yan. Wala na siya, wala na siyang gawin. Hindi na niya.
Mag-aalaga pa ako ng bata.
Or you can pass it on to your students, answer these questions that I got from the webinar. But anyway, some of you joined late, so you probably were not able to hear all of the presentation of Dr. Buenaventura. So we promise to send you a recording. We will also send you an email because we actually have a report that we will give you for free. It's about emotional intelligence that will also help you. That might be a start kasi, di ba, how well you are emotionally. So with that, we would like to thank everyone kasi 2:57 na. Sabi namin kay Doctor hanggang 3 o'clock lang, may klase pa yan mamaya. So may I now call on Det Arwego to officially close the session.
Okay, so thank you again on behalf of Assessment Analytics. We'd like to thank you again, Dr. Buenaventura, for taking time out of your busy schedule to join us this afternoon and for that very enlightening session. As Carol mentioned, Dr. Buenaventura still has a class, so he really took time for us, for all of you, to discuss this very important topic on mental health. And as Carol mentioned, it's also important that we get rid of the stigma of discussing mental health. It's also interesting to note that aside from the social and moral aspect of addressing mental health in the workplace, investing in creating mental health programs and these policies and getting to know our people better could also generate productive and even financial returns for the organization. So it's really important that we take time to create our policies, take time to get to know our people. There are really a lot of benefits to a psychologically healthy workplace. And as you've heard, some of the activities that we can do are very simple and practical ones. I'd also like to take this time to thank all of you for joining us today. Thank you for your active participation, for your questions, and your contributions to today's discussion on mental health. I hope that you can join us in our future learning sessions.